The approval of a new vaccine is welcome as Britain suffers a surge of coronavirus infections. Regulators say the Oxford University AstraZeneca vaccine has shown around 70% effectiveness against COVID-19, a relatively high figure compared to many vaccines for other diseases, and is safe to use.
As I've said before, and I will say again today, the safety of the public always comes first.
The AstraZeneca vaccine is a boon for developing nations. It costs around $3 to $4 per dose and only needs to be stored at refrigerator temperatures.
Developing countries with less sophisticated cold chain and with smaller budgets will be able to use this vaccine.
Earlier this month, several Western nations approved the Pfizer-BioNTech vaccine, which is around 95% effective. But not only is it more expensive at around $20 per dose, it must be stored at -70 degrees Celsius. Research into the optimum dosing regime for the AstraZeneca vaccine is ongoing. Britain plans to administer the first dose to as many people as possible, rather than focusing only on elderly and vulnerable groups. A second dose will follow up to 12 weeks later for longer-term protection.
There is government pressure to increase the coverage of vaccination, and that's understandable. People want it done as quickly as possible. But if you end up putting more people in hospital because they're vulnerable and they didn't get the full regime of the vaccine, then that means that our hospitals are still going to be under pressure.
The British government has welcomed the approval as a cause for great optimism.
We can now see our route out of this pandemic.
But the road to recovery will be difficult. Britain is struggling with a surge of infections driven by a new variant of the coronavirus that doctors say is over 50% more infectious. There are record numbers of hospitalisations, with patients being treated in ambulances as hospital beds are running short.
Control room staff are having to make incredibly difficult decisions to decide who gets an ambulance and in what order, quite often with huge numbers of people waiting for ambulances and they have nobody left to send.
Several cases of the new mutant virus have now been found in other countries. Scientists say its spread makes the global rollout of vaccines even more urgent. Henry Ridgewell for VOA News, London.